He doesn't just run for fun. Yes, Gibson Glass enjoys his jogs through New York's Central Park, but he also needs to stay in shape. He's one of millions of Americans without health insurance. In fact, for Gibson, keeping fit is his insurance.
Everybody should have health insurance. Everybody should be able to afford it. Whether you have an income like me, and I have a pretty good income, I just cannot afford the health insurance. There are people who should have health insurance who are unhealthy and in dire straits. They should be able to go to the doctor whenever they want, whenever they feel bad, and they don't.
This is American healthcare at its best. The New York Presbyterian. At top hospitals like this, equipment is state-of-the-art and more available than in many other wealthy countries. And the care is that bit more luxurious. In America, you get what you pay for, and health is no exception. Anthony, with good private insurance, has a room with a view and as much attention as he could hope for. As for those without insurance or government assistance, here, as in other American hospitals, they get good treatment, but they're only admitted through the emergency room.
American medicine has probably some of the best medical research, technological advances, methods of treating people, research, education of any place in the world. There's a large amount of very good medical care given. What needs to be fixed is that be made more fully available to all the people in this country.
Americans can't agree on the best way to make healthcare more accessible. Some people feel it should be left to the free markets, encouraging competition. Others feel that America should adopt a more European-style system in which the government plays a much bigger role. Sophie is a yoga instructor. Exercising on her rooftop helps her contemplate. She didn't have insurance, fell ill, and struggled to pay the bills. Now she does have basic insurance, but still worries.
Last week, actually, my eyes started getting all red, and I'm thinking, I have to figure out how. And I think that's the problem, is the idea that you need to figure out how in America to go see a doctor if you're uninsured or have basic insurance, where a number of other countries just say, okay, there's a clinic down the street, I can go there, that's no problem.
Back in Central Park, Gibson is still running. For him, Sophie, and too many Americans, worrying about how to pay for health is an uncomfortable fact of life. Barnaby Phillips, Al Jazeera, New York.